Welcome back, friends. Today I am going to discuss in detail about anesthesia pharmacology. Mind you, this is the most important part in anesthesia because almost 50 to 60% of MCQs in any of the exams you will be supposed to give comes from this topic, and I am going to discuss in detail the whole of pharmacology related to anesthesia. I am going to talk in detail about inhalational anesthetic agents, local anesthetics, sedatives and hypnotics, IV induction drugs, muscle relaxants and anticholinergic drugs. So please be attentive and please attend to this particular session. Now talking about inhalational agents, the most important, I am going to talk following drugs in relation to inhalational agents. That is nitrous oxide, halothane, N-fluorine, isoflurane, DESFLURANE and sevoflurane, and to a certain extent XENON. These are the inhalational agents normally used by an anesthetist to maintain anesthesia. I am going to talk in detail. I am going to make it as simple as possible for you by using comparative pharmacology and just using charts so that it will be easy for you to remember and memorize the things. Starting with nitrous oxide. Nitrous oxide is also called as laughing gas, because while using nitrous oxide alone, the patient after coming out of nitrous oxide is in very happy mood. That's why it's always called a laughing gas. Now coming to the chemical structure, it's a low molecular weight, sweet smelling gas. Analgesic effects of nitrous oxide are prominent, but there is skeletal muscle relaxation is very minimal. It is non-inflammatory, but it supports combustion. That's why it is not used in laparoscopic surgeries. It is poorly blood soluble and achieves rapid blood alveolar concentration. Awareness is a major drawback with nitrous oxide. Hence, it is always administered with opioids and with other volatile anesthetic agents while giving general anesthesia. Alone, nitrous oxide cannot be used as an inhalation agent to give general anesthesia. It is always used in combination with opioids or other volatile agents. Now coming back to uses, I have grouped it into uses and drawbacks in a chart so that it will be very useful and very easy for you to memorize the things. As you can look on the slide, the uses of nitrous oxide, it can be used or it is used to maintain anesthesia, that is for maintenance of anesthesia. It is also used as analgesic during general anesthesia along with other analgesics like opioids and others. What is the drawback? Main drawback is teratogenicity, hence you should be very careful while using this drug. Diffusion hypoxia is also one of the major drawback. Megaloblastic anemia, it's one of the complications of nitrous oxide. Awareness is also a drawback, hence this agent is always used with combination with other agents, because alone if you use nitrous oxide, patient will always complain of awareness during surgery. And another major drawback is no muscle relaxation. So coming back again to uses of nitrous oxide, it is used for maintenance of anesthesia, it is used as analgesic along with other agents during general anesthesia. And drawbacks, just as I said before, teratogenicity, diffusion hypoxia, megaloblastic anemia, awareness and muscle relaxation. Now talking about halothane. Halothane, it's a clear non-inflammable liquid at room temperature. This is the most important inhalational agent which is used for maintenance of anesthesia during each and every surgery unless it is contraindicated. I'll talk about the situations where halothane is contraindicated, but it is the most widely used and rampantly used inhalational agent. Coming back to the chemical structure of halothane, it is clear, non-inflammable liquid at room temperature. It has got a sweet and non-pungent smell, hence it can be used for induction of anesthesia in pediatric cases. It has got intermediate solubility and high potency. That's why it permits rapid onset of action and also rapid recovery as soon as you switch off the halothane. It decomposes into hydrochloric acid and hydrobromic acid and also into phosgene. Hence, it is stored in amber colored bottle. If halothane is stored at room temperature in a colorless bottle or in a normal bottle, halothane evaporates rapidly. Hence, it should always be stored in amber colored bottle. This is very important from MCQ point of view. Halothane is always stored in amber colored bottle because it rapidly decomposes into hydrochloric acid and phosgene. So to prevent its evaporation, it is always stored in an amber colored bottle. Now what are the uses? It can be used as an induction agent, just as I said, because it has got sweet, non-pungent smell. It can be used to induce pediatric cases. Only with halothane you can induce a pediatric patient. It is used for maintenance of anesthesia along with other inhalational agents and opioids. It can be used for prolongation of anesthesia, just as when the surgeon is about to get finished and duration of action of muscle relaxant is over and you want to prolong the anesthesia for some time, say for some few minutes. Here halothane comes as a handy tool and you can increase or prolong the duration of anesthesia with the help of halothane. It can be used to remove retained placenta. This is single most drug. Only with the use of this drug or this agent, inhalational agent, retained placenta can be removed very safely. In some patients it may have some problem or you might have to add some additional agents, but halothane per se can be very useful in patients suffering from retained placenta after delivery because it causes cervical dilatation alone. What are the drawbacks? It is rapidly decomposed, as I said before, because it is decomposed into hydrochloric acid, hydrobromic acid and phosgene. Hence, it has to be stored in amber colored bottle. It has got potential for arrhythmias when used with epinephrine or adrenaline. Hence, whenever surgeon uses local adrenaline, xylocaine with adrenaline, you are supposed to switch off halothane as quickly as possible because it has got potential for arrhythmias when used with epinephrine. It cannot be used in pregnancy because it crosses the placental barrier and cause fetal hypoxia. Hence, whenever you are going to operate on a pregnant female for some other surgery, halothane is contraindicated. This is very important from MCQ point of view. You should always remember halothane is not given in pregnant females. It has also got hepatotoxic potential. So coming back again to uses and drawback, I'll just repeat it for you. Uses: it can be used as induction agent, sole induction agent in pediatric cases. It can be used for maintenance of anesthesia. It is used for prolongation of anesthesia and also used in retained placenta. And what are the drawbacks? Drawbacks are same. It is rapidly decomposed. It has got potential for arrhythmias when used with epinephrine. It cannot be used in pregnancy because it crosses the placental barrier and it is hepatotoxic. Now the third inhalational agent, that is isoflurane. It is very important agent. It is halogenated methyl ethyl ether. Its chemical structure is it's a halogenated methyl ethyl ether. Please remember this carefully because this is an MCQ asked in your exams. It is halogenated methyl ethyl ether. It is clear non-inflammable liquid, but it has got pungent and ethereal odor. Since this liquid has got pungent and ethereal odor, it cannot be used as a sole induction agent. Please keep this in mind. It cannot be used as a sole induction agent because it has got pungent and ethereal odor. It has got intermediate solubility and very high potency. The onset of action is very rapid and recovery from anesthesia is equally rapid. Thus, summarizing the whole chemical structure of isoflurane, it is halogenated methyl ethyl ether. It is clear non-inflammable liquid. It has got pungent and ethereal odor, hence cannot be used as a sole induction agent. It has got intermediate solubility and very high potency. It has got rapid onset of action and equally rapid recovery from anesthesia. What are the uses? Uses are, since it is rapid onset and recovery from anesthesia, hence it can be used in daycare surgery or ambulatory surgery. It is cardiostable, hence it can be safely used in patients having cardiac ailments, suffering from some previous cardiac disorders or cardiovascular disorders. It can be safely employed in those patients and it has got less hepatotoxicity. Again, coming back to uses, it is rapid onset and recovery from anesthesia, hence can be used in daycare surgeries. It is cardiostable and it has got less hepatotoxic potential. Drawbacks: the main drawback of using isoflurane is it requires a special apparatus to deliver isoflurane. It is very costly and potential for nephrotoxicity is very high. Hence, isoflurane should be very cautiously used in patients suffering from renal failure. It can be readily used in patients with cardiac ailments, but if patient is having some renal problem and is suffering from renal ailments, you should not use isoflurane because it has got potential for nephrotoxicity. Now the fourth drug which I am going to talk is DESFLURANE. Again I am going to list it out in a proper manner just to tell about this chemical structure. DESFLURANE is fluorinated methyl ethyl ether. Again, it's a fluorinated methyl ethyl ether. It is more stable but less potent than isoflurane. That means isoflurane is more potent than DESFLURANE. It is more stable and less potent than isoflurane. It has got a pungent smell again, so it cannot be used as a sole induction agent. It has got high vapor pressure and hence requires special apparatus for delivery. Just as in case of isoflurane, even DESFLURANE requires a special apparatus for its delivery because it has got very high pressure. Low blood gas solubility and precise control of delivery of anesthesia distinguish it from others. This is a very important point in case of DESFLURANE because it has got very low blood gas solubility as compared to others. Hence, precise delivery, precise dose or dose of drug can be delivered during anesthesia, which distinguishes it from others. This is very important point. You please keep in mind, DESFLURANE is the only drug which has got low blood gas solubility and hence precise delivery of dose during anesthesia can be given only with DESFLURANE. Now what are the uses? Precise delivery of anesthesia, just as I mentioned now. And the second use is it's a very rapid recovery. That's a very important point. Since it has got rapid recovery, it can be used in daycare or ambulatory surgeries. What are the drawbacks? Again, special apparatus is required. So coming back to uses, precise delivery of anesthesia and rapid recovery are the uses of DESFLURANE, but the drawback is special apparatus is required to deliver DESFLURANE. Talking about sevoflurane, now its chemical structure, it's a fluorinated isopropyl ether. I'll just repeat all the three for you. Isoflurane is halogenated methyl ethyl ether, whereas DESFLURANE is fluorinated methyl ethyl ether, and sevoflurane is fluorinated isopropyl ether. This is its chemical structure. It can be administered with normal breathing systems. It is less soluble in blood but very highly potent. Prompt induction and rapid recovery distinguishes sevoflurane from others. It has got non-pungent smell, hence can be used for induction, and it causes bronchodilation. That is very important. Sevoflurane causes bronchodilation, hence can be used safely in patients suffering with asthma and COPD. So again, coming back to chemical structure, it's a fluorinated isopropyl ether. It is administered with normal breathing systems. It is less soluble in blood and highly potent. Prompt induction and rapid recovery is the major thing that distinguishes sevoflurane from others. It has got non-pungent smell and causes bronchodilation. Now, what are the uses? It can be used as induction agents, just as I said before, because it has got non-pungent smell. It is very highly potent. Prompt induction and rapid recovery, hence can be used in daycare or ambulatory surgeries. Less chances of hepatotoxicity with the help of sevoflurane, and again it is cardiostable, hence it can be used in cardiac surgeries. Drawbacks: it is very costly, and nephrotoxicity, again nephrotoxicity is a major drawback, so you have to use very cautiously in patients suffering from renal ailments. XENON, this is the last drug. This is an inert gas. It is non-pungent and odorless. It has got minimal cardiac depression and hence it is always used in cardiac surgeries. Emergence is 2 to 3 times faster than isoflurane or sevoflurane. That means XENON is a gas. When used, it can be used very quickly. Emergence is 2 to 3 times faster than isoflurane or sevoflurane. So I have discussed in detail about all the 6 inhalational agents, their uses, their drawbacks, their chemical structure and the nature. Now I am going to talk in detail about their systemic effects on each of the system, that is CNS, central nervous system, cardiovascular system, respiratory system, hepatic system and renal system. To make it simple for you guys, I have just noted it down in the form of charts where there will be comparative pharmacology between all the drugs, and I have listed certain points under each system, how you distinguish each one from others. As you can see on your screen, central nervous system, there are certain things which happen in central nervous system. I have listed them along the y-axis, and along the x-axis I have made a chart of all the drugs so that it will be very easy for you to compare. Now looking at the chart, what are the effects that central nervous system has because of inhalational agents? That is amnesia, seizure activity, cerebral blood flow, cerebral metabolic requirement, intracranial pressure, and CSF production. And then there will be comparative pharmacology. I have compared nitrous oxide, halothane, desflurane, isoflurane, and sevoflurane. Now coming back to the first point, amnesia. Amnesia is practically nil in any of the inhalational agents. That means awareness is possible if you use any of these inhalational agents alone. Hence all of these inhalational agents have to be used in combination with other opioids and analgesics so that amnesia or awareness is not present. Seizure activity, coming back to seizure activity, only nitrous oxide among every one of them, only nitrous oxide has got potential for seizure activity. Now coming to cerebral blood flow is increased massively with halothane, also to a certain extent with desflurane, isoflurane, and sevoflurane. Cerebral blood flow is marginally increased in case of nitrous oxide, as you can see on your screen, at low MAC, that is molecular alveolar concentration. Now cerebral metabolic requirement, it is practically decreased in each one of them, but isoflurane decreases cerebral metabolic requirement to the maximum extent. Intracranial pressure is increased in practically every one of them, like from nitrous, halothane, desflurane, isoflurane, and sevoflurane. All of them increases the intracranial pressure. Now CSF production, that is cerebrospinal fluid production, there is no effect because of any of these inhalational agents on CSF production. Only in case of isoflurane, there is decreased reabsorption of CSF. Now coming back to the changes that happen in cardiovascular system, as you can see on your screen, pulse rate is increased in practically all of them except for halothane. In case of halothane, there is no change in pulse rate of a patient. Cardiac output is increased in case of, to a certain extent, in case of nitrous oxide, whereas there is no change with halothane, desflurane, isoflurane, or sevoflurane. Then mean arterial pressure, there is no change while using any one of them. Systemic vascular resistance, there is no systemic change in systemic vascular resistance with nitrous or halothane, whereas systemic vascular resistance is decreased in desflurane, isoflurane, and sevoflurane. Pulmonary vascular resistance is increased in case of nitrous oxide, whereas there are no changes with any of the other four agents. Arrhythmias, the potential for arrhythmias, as I said earlier, is only with halothane, and there is no change with any of other inhalational agents. Coronary blood flow, there is no change in coronary blood flow. Only in case of isoflurane, there is marginal increase in coronary blood flow. Now coming back to respiratory system, this is the third system. What are the effects of inhalational agents on the respiratory system? Respiratory rate is increased in practically each one of them, each one of the five, that is nitrous oxide, halothane, desflurane, isoflurane, and sevoflurane. Increase in the respiratory rate can be seen in all of them. Tidal volume is decreased in all of them, practically nitrous oxide, halothane, desflurane, sevoflurane, and isoflurane. All of them decrease the tidal volume. PCO2, that is partial pressure of carbon dioxide, is increased in each one of them. So you cannot distinguish each one of them. Practically all inhalational agents have same effects. Airway resistance is increased in case of nitrous oxide, whereas it is decreased in case of halothane, desflurane, sevoflurane, and isoflurane. Now response to carbon dioxide is practically nil in case of nitrous oxide, whereas it is decreased in case of all other inhalational agents. So effects on the respiratory system basically are minimal because it is all the inhalational agents are rapidly excreted from the lungs itself. The effects on hepatic system, hepatic blood flow, nitrous oxide has practically no effect on hepatic blood flow, whereas hepatic blood flow is increased in case of desflurane, isoflurane, and sevoflurane, as you can see on your slide. Then portal blood flow. is practically there are no changes in case of nitrous oxide, whereas portal blood flow is decreased in case of halothane, desflurane, isoflurane and sevoflurane. LFT, that is liver function test, they are deranged in case of halothane, very much deranged in case of halothane, that shows potential for hepatotoxicity, whereas there are marginal changes in desflurane, sevoflurane and isoflurane. As you can see on your slide, the changes are very well shown on your slide, so that it is very easy for you to compare each of the inhalational agent with other. Because this is important, because in your exam sometimes they do ask you questions to compare nitrous oxide with halothane or halothane with sevoflurane and halothane with isoflurane. So you should be aware of this particular chart which I have shown, and you should memorize this particular chart and just keep in mind which drug causes hepatotoxicity and which drug causes nephrotoxicity. So which drug has to be used in hepatic patients suffering from hepatic ailments and which drugs should be avoided in patients suffering from renal ailments. Now hepatotoxicity, potential for hepatotoxicity, just as I mentioned, is very high in case of halothane, whereas in case of sevoflurane and nitrous oxide it is practically nil. Hence nitrous oxide and sevoflurane can be used very easily in patients suffering from hepatic diseases, whereas halothane has to be avoided in case of patients suffering from hepatic diseases. Now coming back to renal system, practically there is no change in renal blood flow with nitrous oxide, but the other things, that is halothane, desflurane, isoflurane and sevoflurane, they decrease the renal blood flow, they do decrease the glomerular filtration rate, and they do decrease to a certain extent urine output. Very important point in renal system to keep in mind is sevoflurane causes renal toxicity because of presence of vinyl halide, that is one of the metabolites which is produced by sevoflurane, and that is the metabolite which results in renal toxicity. This is very important from MCQ point of view. Please keep in mind sevoflurane metabolizes to vinyl halide, and that has got potential for renal toxicity. Hence sevoflurane has got potential for nephrotoxicity. So sevoflurane should always be avoided in patients having renal failure or having some problem with kidneys. Hence this drug should be avoided in these patients. So talking about inhalational agents, I have talked in detail about 6 of the agents. I have told you their chemical structure, their drawbacks. Around 20 to 30% of MCQs asked till date come from this particular topic. So you should know in and out all the inhalational agents, where it is used, what are the drawbacks, and which drugs should be avoided in cardiac patients, in nephrotoxic patients, and in hepatotoxic patients. Just to memorize or just to remember the same, halothane should always be avoided in hepatotoxic patients or patients having some hepatic disease. Halothane should be avoided in pregnant females, whereas sevoflurane has got nephrotoxic potential, hence it should be avoided in renal patients. Isoflurane and sevoflurane, because they are cardiostable, they can be used very easily in cardiac patients or cardiac surgeries. Nitrous oxide or laughing gas, it has awareness, hence it should always be used in combination with other agents so that amnesia occurs. Halothane has got a sweet odor along with sevoflurane, hence both these drugs can be used as an inducing agent, whereas other drugs, because they have got pungent smell, they cannot be used as induction agents solely. So these are some of the points, positive points and negative points, which you should remember in this particular chapter. In next chapter, I'll talk about local anesthetics in detail. Thank you very much.